that PLAB exam, and compared to our Indian exams are tough. They're legitimately tough. I'm not going to discount PLAB being tough or not, but generally much easier, I thought, compared to our postgraduate exams, for example, in India. And once I got into that, and again, system was different because we are talking about 99, 2000 here, so more than 2 decades ago.
Yeah.
But what used to happen that you used to go for the exams, and then there were two steps for the PLAB. One is the basic sciences, second was clinical sciences, and then you sort of apply to the NHS, which is National Health Service hospitals, which are essentially government hospitals spread all across UK. And then if depending on your overall career by then, and your ability to merge yourself, in terms of communication, in terms of sort of easiness which you can blend with the local community and so on, then they would give you an opportunity to do like an attachment, we call, or sort of an externship, where you are with whatever department you want to do your residency or future training in. You spend time for like sometimes 4 weeks, sometimes 6 weeks, sometimes 6 months, depending on the requirement, depending on the specialty you are going to go there. So I had a chance to spend time in a place called Newham General Hospital, which is in East London.
Mhm.
Now that name is changed. Now it's a Newham University Hospital because that hospital has evolved itself in the last 2 decades. But I went into that, and then I worked with. I did my attachment actually, and again, as my gratitude to my first teacher outside India, his name was Mr. Ravindran. So he was a Sri Lankan Tamil OBGYN doctor, amazingly
Wow.
gifted, amazingly gifted. And although English was the common language, but he was so fond of me, and then I hope I did some good clinical work for him, that he introduced me as to, hey, this is how the system works. This is how, if you want to do the career, these are the paths, these are the opportunities. So it wasn't like backsiding or trying to nudge our way, like what we call the Sifarishi business. So we were not, he didn't like write anything for me or called anybody to get me a job or something like that.
Mhm.
But you need a guru when you embark on a new field. Maybe it's a sadhana, maybe it's a prayer, a ritual, your life. You need a mentor. And
Right.
he was an amazing mentor to me. And I'm got to admit, now he's retired happily in Australia, I believe, with his son. So not even in England. We're still in touch, but he made that difference. And that must be said because you got to remember those who kindly helped you. And then I applied for the OBGYN training programs, and then I matched into East London deanery, they call it, like a university. It's like a deanery. And again, I'm telling you what was in 2000. A lot is changed since then,
Sure.
in terms of medical education. But went into that and then did my initial part of training in East London. The last 3 years were done in West Midlands, which is Birmingham, Edgbaston, that famous cricket ground is,
Yep.
um, and Coventry, which is another famous city, as we would have read in our history books, the city which was bombed, thinking that it was London by Nazi Germany. So the Coventry was very famous, historic city, basically. So I completed my training there.
So when you
And
say
they
training, it's technically residency
Correct.
or
It is, yeah,
okay.
no, you're right. You're absolutely right. It is like a residency, framed much differently than
Okay.
Indian residency. To give a perspective, Indian residency, say in OBGYN, then and is 3 years long, where you are an intern in 1 year, the first year, the second year, you're a junior resident, and in the third year, you are a chief resident. So there is sort of like a pyramid system that, seniority brings you to the tip
Yeah.
of the pyramid, basically.
Yeah.
In England, it is different. It is 7 years long in England. So the four initial first 2 to 3 years are called SHO. And again, this nomenclature is 20 years
Yeah.
old. I'm pretty
Yeah.
positive there is some change in that. But we used to be called senior house officers. So essentially the junior level doctors. Then you became sort of a chief trainee or chief resident doctor, basically.
Mhm.
So you're no longer a house officer, so that's sort of a promotion. But you're not a consultant or a practicing physician. You're still
Yet.
your
Okay.
senior level. Yeah. And then out of those 7 years, last 2 years are geared towards developing a specific interest, which is still yet to come in India. Although people are now sort of further subspecialty wise from a
Hmm.
specialty. Like, for example, easy to understand is you have to do an internal medicine residency, and then you do cardiology fellowship, and then you are a cardiologist. If you do nephrology training after your internal medicine, then you are a nephrologist.
Right.
There was nothing in OBGYN at that time. So OBGYN was gynecologist and obstetrician. That's it, you know. But after going to England, then I realized, and now it has come to India, slowly coming, it's
Hmm.
percolating, but it's not systemic, it's not well defined, it's individual, sort of motivation. Um, I'll explain that in a second. But in UK, I realized that suddenly, after completing 5 years in general obstetrics and gynecology, then suddenly you are exposed to distinct subspecialties of OBGYN. So
Hmm.
one being urogynecology. Urogynecology is to do with urological anatomical problems which women encounter, typically menopausal, postmenopausal time frame. And it requires a lot of pelvic surgical approach to try to anatomically fix it, medical approach to train the bladder, and so on and so forth. We're talking about urinary bladder here. So that was urogynecology. Then the second aspect was gynecological oncology. So specifically dealing with the malignancies, cancers of
Yeah.
vagina, cervix, uterus, tubes, ovaries, and peritoneum, pelvic peritoneum, basically. The third was maternal fetal medicine, where those so-called high-risk pregnancies, they were managed by these doctors or co-managed by these doctors. Then fourth one was reproductive endocrinology, which
Hmm.
was essentially your infertility management, the IVF, test tube baby, XC, hormonal manipulation, whatever. And then fifth one was the minimal access surgery, which is laparoscopies, which is rather than making those ugly big
Yeah.
cuts on the abdomen, you do laparoscopic surgery. So, and that was like light bulb lit up in my head. I never thought after completing my residency in India that there could be. I mean, I used to read in the books, of course, so I knew about these terms and what they do, but actually having that opportunity was like a big deal. And I'm pretty confident sooner or later this has to be developed in India. There is no option. As we are getting more, our perspective is broadening in every sense. It should broaden and it will broaden in this manner. And
And
then I
laparoscopic
became, yeah,
surgeries have become kind of, a routine now, popular now, rather, in India now.
yeah, yeah,
Hmm.
yeah. But now the robots have come in to do the
Yeah.
laparoscopic surgeries. So yeah, that's like amazing thing. But in my last 2 years, I became the reproductive endocrinologist actually. So participated in infertility management, test tube babies, IVFs, and ICSIs, and all sorts of hormonal manipulation. So it was pretty amazing experience. And frankly, I
Hmm.
never thought that I would go to the United States thereafter. I thought I was like completely settled in, like anchored.
Yeah. So why was the switch, and what made you go to the US?
Oh
Because you've
man,
already spent like 5 years in the UK, and
no,
you've
actually,
been continually studying all the time.
yeah.
So I mean, that's too much of investment, time investment, money investment. I don't know. I mean, a lot of patience as well.
Yeah. No. So, I mean, it was funny. So I was like a Peter Pan, basically, who doesn't grow up, you know? So, and again, what I wanted to do was to take the advantage of the fact that I wasn't pressed to start earning, basically. Now, I got to mention here that the pay for a resident doctor in England,
Hmm.
even with respect to your lifestyle in England, it was far superior compared to a trainee in India. You know, for that matter, the resident in England perhaps was earning way more compared to a doctor maybe in his fourth or fifth year of his practice in India. So I'm not going to by any means pretend that we had to be stressed out for money. No, we were very
Sure.
reasonably paid. Um, but I was learning something new, and
Hmm.
that was important. When first time I came to England, and again, this is nobody's fault, and in fact, I took it in a very positive note that my entire first to 10th grade was in a Marathi medium school, vernacular, absolutely
Yeah.
Marathi. Even my college in Dombivli, yeah, sure, the subjects were in English, but the communication was in Marathi, as it should be. I'm absolutely proud of that. So when I went to medical school in essentially in Grand Medical and then Sion Hospital, both of them happened to be in the heart of Marathi land, which is
There you go.
Mumbai. So it was, yes, education was in English, but I wasn't talking to patients in English. I was communicating them in Marathi, in
Yeah.
Hindi, and so on. So going to England was my first real taste of English. And I must admit, I learned again so much about English. Of course, English is still my second language. So I'm not proficient. I cannot say that I'm like totally well versed or pro in English. But I learned real English, I would say, not, like, Queen's English, so to
Yeah.
speak.
I was just
And
gonna
I'm,
say Victorian
yeah,
Queen's English.
exactly. That was in England. So even in that aspect, it was, interesting to learn. And don't want to get into any political situation or discussion in here, but I was always curious about what are our colonial once upon a time masters wear, how they are, what they talk. It was more of a curiosity.
Yeah.
And I still don't know how this happened because they are generally speaking reasonable people. I don't know how we were their colonial territory. There was nothing special. Let me put it this way. But it was a good learning opportunity.
Mhm.
Now, when it came to England, and I kind of blame my amazing wife for that. So her sister moved to the United States. She's an engineer and she started working, and she still does work in a big multinational IBM, basically in
Mhm.
Boston. And, we visited them when we were in England. And looking at that setup, looking at interacting with Americans, for example, it was starkly different than England. And I'm like, man, this looks way more, amazing opportunity
Mhm.
uh, uh, to live your so-called American dream,
Mhm.
in a way. I was, I mean, again, I want to emphasize here that we did not move America to pursue the American dream because
Mhm.
God had gifted us with. I had my family then, my children then. We were settled in England. We had a house in England. But there was some bizarre, whatever, fascination or something after visiting United States, particularly in New England territory, which is Boston and New York and so on and so forth. Um, I really liked that. And then a few of my friends by then who had either moved from India to the US or from England to the US, then of course I interacted with them. And they are like, dude, come along. It could be more exciting. If you don't like it, you can always go back. I mean, it's not like you're going to lose a lot.
Mhm.
And then again, it helps to be financially reasonably stable. So you're not pressed like, oh my God, if you don't work for 5 months, then it's going to be a problem. How are you going to pay your bills, basically? So there was some saving done by myself when I was in England. So Mansi decided she's going to taste the waters of America first. So she took the exam which you mentioned earlier, the USMLE entrance
Mhm.
exam she took, and she got amazing score, like 99
Mhm.
percentile in all steps. So when she applied at that time, and I'm talking about perhaps 2004, 2003 year, it was very tough for Indian citizens to get American visa. Even
Mhm.
forget about actually working, you're talking about visiting, as B1, B2
Yeah.
visa was hard. Uh, she got into residency straight away in Pennsylvania. Again,
Wow.
I didn't believe that, okay, it is that nice. You know what I mean?
Yeah.
After working in it, I'm like, how different, more different it's going to be. It's the same
Yeah.
illnesses. Of course, population speaks in a different manner, which is in American accent instead of the British accent. But
Yeah.
there are diseases are the same. What difference could it be? And to my surprise, it's a lot more hard work in US compared to UK because
Mhm.
UK has that work limits, how many hours you can work during week. In US, like our old Indian system, you slog. I'm sorry to use the word, but you work your butt off, basically.
Yeah.
And you learn. And she loved it. I mean, she
Mhm.
absolutely loved it. So we practically lived separately for nearly 2.5 years, not by choice, of course. And then she was like, you know what, Sanjay, this actually seems pretty reasonable. At least we are not going to be like going demoting ourselves from where we were.
Mhm.
We are actually going to seek new adventure, and hopefully that plan is going to be successful. So yeah, there were uncertainties, but then I took that USMLE exam. I did well in that exam. Of course, she's still my smarter half, so she did better. And then I got into residency program as well. The kicker was the training in the United States also is 7 years. So after completing my first residency in England, 3 years, 7 years in
Yeah.
UK, practicing for a year or so after that, 4 years of residency, I had to do it again
Wow.
because I always wanted to do subspecialization. I was
Mhm.
not interested for routine general OBGYN because I
Mhm.
always wanted to learn. And I had learned basic OBGYN twice by now. There is no point learning in third time. So
Yeah.
this time, I wanted to do career in maternal fetal medicine, which is your natural progression from reproductive endocrinologist. You are helping the patient to get pregnant. And then the MFM comes in, takes away the patient and looks after her till she delivers. So I wanted to learn that next step. And
Mhm.
that's when I did my maternal fetal medicine fellowship. Um,